Okay, so in today's video, we will be kind of briefly talking about pleurisy. So when we look at the pleura has two different layers. And the purpose of the pleura is to cushion the lungs. The pleura has two different layers. Like I said, it has the visceral layer and then it has the parietal layer. The visceral layer covers, it's the inner layer, so it covers the lungs and it basically wraps around the lungs and it's pretty much stuck very tightly against the walls of the lungs. And if you ever wanted to imagine you wanted to peel it off, it'd be very hard to do so. Other layer, the parietal layer, covers the chest wall. And then in between these two layers, there is the pleural space. In the pleural space, you have lubricating fluid, which is the pleural fluid. And this fluid is basically very similar to other fluids that you have in your body, such as the synovial fluid, which provides cushioning for your joints. Likewise, a lubricating fluid basically makes sure that the two layers, when they're sliding against each other, do so smoothly. So what is pleurisy? So pleurisy, also known as pleuritis. So anytime you hear the word ending in itis, it indicates some sort of inflammation, right? So with pleurisy or pleuritis, we have inflammation of the pleural layer. And this can be caused by a variety of conditions. So the primary conditions that we can look at can be things like infections, which could be viral or bacterial, and they could be something as common as the flu, pneumonia, autoimmune diseases, so it could be something like lupus, chest injury, so you could have a pneumothorax or pleural fusion, which is fluid buildup in the lungs, and pneumothorax is lung collapse, or something even such as a PE, so your pulmonary embolism can actually cause pleuritis. Who is at risk of developing pleurisy? So adults, usually ages 65 years and older, are at risk for developing pleuritis. If you think about the fact that adults ages 65 years and older are more prone or at high risk for developing lung infections or more prone to get sick, that would make sense that they could possibly have or develop pleuritis if they do get an infection. Classic sign of pleuritis is something called pleuritic pain, which is when you have a sharp stabbing pain when you breathe in deeply, okay? And it could be when you cough, sneeze, or laugh, but it's usually a sharp stabbing pain when you breathe in. So you may also have other symptoms depending on the cause of the pleuritic pain. And so if you have an infection, you could possibly have some fever or chills. You could have some shortness of breath if you have something like pneumothorax or pleural effusion or a pulmonary embolus, and you may also have a dry cough. Other symptoms would include things like shallow breathing, also possibility for radiating pain to your shoulders and back. And this could be related to that pain just radiating to your shoulders or back, or if you go into the emergency room, providers might want to eliminate things like an MI, and so therefore, for that reason, you may have to get an EKG done. Okay, and one way to figure out upon assessment of a person with pleurisy upon auscultation. So if you are following the nursing assessment, you have things like inspection, percussion, palpation, and then auscultation. So when you auscultate someone who has pleurisy, you may hear something called a pleural friction rub. That is a rough, scratchy sound that's usually made when, remember, when our two layers are not supposed to rub against each other roughly. They're supposed to slide and glide uh, amongst each other smoothly. So when these two layers are rubbing against each other during the breathing, when you're breathing, that is called the pleural friction rub, and that's very common when patients have pleuritis. Some of the diagnostic examinations would also include things like chest x-rays, labs, ultrasound, CT, MRIs, or even ABGs. So chest x-rays obviously would allow us to see or view the lungs to see whether there was anything like pneumonia, any injuries, if there's any fluid, indicative effusions, labs would obviously be, if we do a complete blood count, we'd be able to see whether there was any bacterial or viral infections where your WBCs were elevated. It would also indicate whether there were things like rheumatic fever, lupus, or a PE. An ultrasound would actually show a location of fluid in the case that there was a pleural effusion, and other diagnostic examinations would include a CT or MRI, which would show whether, again, whether there was fluid in the lungs or if there was an exact tumor growth, the exact location of the tumor growth. And then ABGs, your arterial blood gases, would basically determine your lungs' ability to absorb oxygen and then get rid of carbon dioxide, okay, to kind of figure out if you're retaining any carbon dioxide, because if that were the case, then it can lead to things like respiratory acidosis and then possibly respiratory failure if not corrected. So what sort of treatments are available for pleurisy? So the main primary symptom of pleurisy is pain. So we're looking to really focus on pain management, and that will be through the administration of non-steroidal anti-inflammatory drugs, okay? This will help decrease that inflammation and also thereby also relieving that pain. Another main symptom or another main treatment is to really treat the cause of that pleuritic pain. And if it's a bacterial infection, you're looking to treat with antibiotics. If it's things like a pneumothorax or a pleural effusion, you might be looking to do a thoracentesis to drain out that fluid. And then you also have other symptoms. You may or may not have a dry cough. If you have a cough, you're looking to maybe administer some cough syrup. And at the end of the day, you really want to look at resting and just healing, right? So just resting your lungs and allowing your lungs to heal. Also, other medications might be steroids as well to bring down that inflammation.